Welcome back to our journey into the world of certified nursing assistants. In our last episode, we saw the spark of passion ignite. Today, we dive deep into the hands-on skills that turn that passion into a profession. This is where the learning curve gets steep, but the rewards are immeasurable. We begin in the training lab, where theory meets practice. The year is filled with a new sense of purpose. Yesterday was about the why, today is all about the how. The first lesson is the cornerstone of patient assessment, vital signs. Temperature, pulse, respiration, and blood pressure. These aren't just numbers on a chart. They are the first chapter in a patient's story, a story that a CNA must learn to read fluently. Imagine this, you're holding a digital thermometer. It's beep a small but significant signal. You're wrapping a blood pressure cuff around an arm, feeling for the faint but steady rhythm of the radial pulse, as the gauge on the sphygmomanometer climbs and then gently releases. You listen with a stethoscope for that distinct lub-dub sound, 120/80. It's a textbook perfect reading. But the real lesson isn't just about getting the numbers right. It's about the process. It's about the calm, confident touch that reassures the person in front of you. Calm hands make calm patients. Every beat you count, every breath you observe, is a profound reminder that life is in the details. You're not just collecting data. You're connecting with a human being. From the clinical precision of vital signs, we move to something equally important, assisting with activities of daily living, or ADLS. This is where the heart of caregiving truly shines. We enter a simulation room, where students practice helping mannequins and volunteers with tasks that many of us take for granted. Helping someone sit up in bed, gently brushing their hair, assisting them with a meal. These are not chores. They are acts of dignity. Think about the vulnerability of needing help with such personal tasks. The role of the CNA is to transform that vulnerability into an experience of respect and comfort. When an elderly volunteer smiles and says, "Thank you, dear. You make me feel human again," it's a powerful moment. It's a reminder that the goal is to see the person, not just the patient. Mastering techniques like Fowler's position for comfortable breathing or the supine position for rest isn't just about following a textbook. It's about using your knowledge to provide genuine comfort. This is where empathy becomes muscle memory, a natural extension of your hands and your heart. Now, let's shift gears to a scenario every healthcare professional must be prepared for: emergencies. The atmosphere in the training hall becomes more intense. Rows of CPR mannequins lie on the floor, ready. The instructor's voice is firm and clear. You won't have time to think. You will only have time to act. The steps are drilled into memory: check for responsiveness, call for help, and begin chest compressions. 1, 2, 3, breathe. The rhythm is relentless, a metronome for saving a life. Students learn the precise hand placement over the sternum, the correct depth of 2 inches for an adult, the rate of 100 to 120 compressions per minute. It's physically demanding and emotionally charged. But this repetition builds a unique kind of courage. It's the courage to act decisively when seconds count. First aid skills, from controlling bleeding to managing choking, are practiced over and over. This isn't about memorizing facts for a test. It's about building a reflex. It's about knowing that in a moment of crisis, your training will take over, allowing you to be the calm in the storm. Courage is learned through repetition and remembered in emergencies. Beyond the physical tasks and emergency procedures lies a skill that can be just as healing: communication. In a simulated hospital room, a student sits with an actor playing an anxious patient who says, "I don't want to be here anymore." What do you do? The student doesn't offer false reassurances or dismiss the feeling. Instead, they sit down, lean in, and say, "I understand. It's okay to feel scared. Let's talk about what's bothering you." This is therapeutic communication in action. It's about active listening, showing genuine empathy, and providing a safe space for someone to express their fears. An instructor points out the effectiveness of a gentle tone and open body language. The therapeutic communication triangle: listen, empathize, reassure isn't just a diagram. It's a roadmap to building trust in many situations. The ability to connect, and communicate effectively can alleviate a patient's anxiety more than any medication. Communication is a powerful tool that heals as much as medicine. And it's a skill every great CNA must master. Finally, to be an effective member of a healthcare team, you need to speak the language. Medical terminology can seem like a foreign tongue at first, full of strange prefixes and suffixes. In the classroom, students repeat after the instructor: cardio for heart, neuro for nerves, hemo for blood. They learn that hypo means low, hyper means high, itis means inflammation, and hemia refers to a condition of the blood. But these aren't just words to be memorized. They are the keys to understanding a patient's condition, to accurately reading their chart, and to communicating effectively with nurses and doctors. Each term is a piece of a puzzle. As students fill their notebooks, whispering the words like lyrics to a new song, they are doing more than just studying. They are learning the language of care. It's a language spoken not just through words, but through charts, symptoms, and above all, compassion. From vital signs to CPR, from assisting with dignity to speaking the language of medicine, these skills form the foundation of a CNA's practice. It's a demanding path, requiring both knowledge and heart. But as we've seen, it's a journey of profound growth. Knowledge empowers care, and skill perfects it. Thank you for joining us for this deep dive into the core skills of a CNA. The journey is far from over. In our next episode, we'll follow our students into their first clinical rotations, where they'll apply everything they've learned in a real-world healthcare setting. Be sure to subscribe and hit that notification bell so you don't miss it. See you next time.